Welcome to this explainer. Today we're jumping right into a massive head-to-head showdown between two absolute heavyweights. I'm talking about those little pills you probably have sitting in your medicine cabinet right now. But we aren't just doing a generic overview, we're zooming way in to see exactly how this rivalry plays out specifically inside the Sudanese pharmaceutical market. We're going to look at where local manufacturing collides with human biology. And as you'll see, picking the right pill, it involves a whole lot more than just grabbing the closest box.
Here's the roadmap for today's explainer. First, we'll go inside Sudanese pharmacies. Then, we'll meet our contenders, break down their mechanisms of action, and dive into side effects and safety. Finally, we'll deliver the final verdict.
All right, part one, inside Sudanese pharmacies. Let's set the stage a bit. The pharmaceutical industry in Sudan is this incredibly vital, highly sensitive ecosystem. It's a space where government regulations, local manufacturing, and international imports all literally have to work together perfectly to make sure everyday folks have access to safe, affordable medicine. And just to put the sheer scale of local production into perspective for you, check out this number. Amura Pharma, which is a major locally owned family manufacturer that's been around since 1975, has captured over 40% of the entire Sudanese pharmaceutical market. 40%. They're making dozens of essential products right there locally, which is absolutely crucial for keeping these medicines economically accessible for the population.
So, the local market leans heavily on these absolute giants, right? Companies like Amma Pharma and Azal Pharma. They're churning out highly effective generic medicines for everything from heart health to fighting infections. But, it's not a solo act. It's a fully collaborative ecosystem. They work right alongside strategic international distributors like Daftra Pharma, a European company that does a ton of work in sub-Saharan Africa. And together, they guarantee that the daily demand for generic drugs across Sudanese pharmacies is consistently met, day in and day out.
Moving right along to part two, meet the contenders.
Okay, so within this bustling market, let's officially introduce the two generic painkillers going head-to-head today, Paracetamol and Ibuprofen. Now, we really want to connect the clinical science to what you'd actually see on the shelf. Because let's be real, when you walk into a pharmacy in Khartoum, you probably aren't asking the pharmacist for Paracetamol or Ibuprofen by their generic names. For Paracetamol, you're almost certainly picking up Amig Pharma's locally made Amidol, or maybe Parol, which is distributed by Dafra Pharma. And for Ibuprofen, you're likely getting handed Petafen, also from Dafra, or Belfen, made by Afrigia. These trade names right here, these are the familiar, everyday faces of our two pharmacological contenders.
Okay, let's dive into this next section. Part 3, Mechanisms of Action.
We know their names, we know who makes them, but what on earth happens once you actually swallow them? To understand the real difference here, we need a super quick crash course in human biology, and it all starts with these things called prostaglandins. Say you're out for a walk and you completely sprain your ankle. Ouch, right? Well, your body instantly starts producing these chemical compounds right at the site of the injury. Prostaglandins are essentially the messengers. They're the guys transmitting the, hey, this hurts, signals up to your brain. And they're also what triggers all that redness, swelling, and inflammation around the ankle itself. Basically, if you want to stop the pain, you've got to stop the prostaglandins.
Now, your body uses a specific enzyme called cyclooxygenase, or COX for short to keep things simple, to manufacture those pain-causing prostaglandins. This is where our drugs come in. Both paracetamol and ibuprofen are what we call COX inhibitors. Their entire job is to block this enzyme. Think of it like an assembly line. No COX enzyme means no prostaglandins, and no prostaglandins means no pain. Simple enough, right? But here is where it gets fascinating. The way they actually block this enzyme is completely different.
Think of your body like a massive, sprawling corporation. Paracetamol works exclusively at headquarters, which is your central nervous system, meaning your brain and your spinal cord. Ibuprofen, on the flip side, clocks in at the local branches, the peripheral tissues out in your body where the actual injury or swelling happened, like that sprained ankle we talked about.
What's really interesting about this slide is how that strategy plays out in real life. Because paracetamol, or Amidol, works entirely centrally at headquarters, it's absolutely brilliant at turning down the body's overall thermostat to reduce a fever. And it's fantastic at blocking pain signals from ever registering in your brain. But it has a very, very weak action out in the peripheral tissues. This means paracetamol lacks any real anti-inflammatory effects. Sure, it'll stop your sprained ankle from throbbing, but it's going to do absolutely nothing to reduce the actual swelling.
Now, contrast this with ibuprofen's playbook. Ibuprofen, which you'll find in brands like Petafen and Belfen, is a non-steroidal anti-inflammatory drug, or NSAID. It acts non-selectively to block those COX enzymes right out there in the peripheral tissues. because it stops the production of prostaglandins at the actual physical site of your injury. It fights both the pain and the inflammation. It's quite literally tackling the swelling right at the source.
Which brings us to part 4, side effects and safety.
You might be sitting there thinking, well, ibuprofen tackles both the pain and the inflammation, so it's obviously the winner, right? Actually, scratch that. It's not quite that simple. Because they take completely different biological approaches, they also come with completely different side effect profiles. Let's look at the risks. Because of where and how they're processed in your body, paracetamol's main danger zone is the liver, whereas ibuprofen's primary threat is to your stomach and gastrointestinal tract.
So the crucial point is this limit right here, 4 grams. Paracetamol is incredibly safe. Honestly, it's probably one of the safest drugs we have, as long as it's used at normal therapeutic doses. But the margin for error is super narrow. If you exceed the maximum daily dose of 4 grams, you completely overload your liver's ability to process the drug safely. That leads to a massive buildup of a toxic byproduct, which causes severe and sadly often irreversible acute liver damage. It's a really big deal.
On the other hand, ibuprofen comes with a totally different set of hazards. Remember how I mentioned it blocks the COX-1 enzyme to stop inflammation? Well, unfortunately, that specific enzyme also plays a vital everyday role in producing the protective mucus lining of your stomach. So, by taking ibuprofen, you're effectively stripping your stomach of its protective armor against its own acid. Over time, or at high doses, this leads to some pretty serious gastrointestinal risks. We're talking everything from severe indigestion and heartburn to potentially life-threatening gastric ulcers and intestinal bleeding.
Let's look at just one more factor to build a complete picture of its safety profile. Unlike paracetamol, ibuprofen's peripheral action also messes with your kidney's ability to manage sodium. This can actually cause fluid retention and a spike in blood pressure. So, for patients dealing with pre-existing cardiovascular conditions or hypertension, paracetamol is almost always the much safer choice.
And that leads us perfectly into part 5, the final verdict.
We've explored the pharmacy shelves, mapped the biology, and weighed the very real risks. Now it's time to pull it all together into a clear mental model so you can make an informed choice the next time you need some relief. And this brilliantly illustrates your ultimate cheat sheet. If you've got a fever or just a standard headache, paracetamol, like Pharma's Amidol, working quietly away at headquarters, is incredibly safe for your stomach, provided you strictly respect that 4-gram daily limit. But if you're dealing with inflammatory pain, like a swollen joint, a nasty toothache, or a muscle sprain, ibuprofen, like Paracetamol, is the one that goes to work at the local branch to actively reduce the swelling. Just remember, you've got to take it with food to protect that stomach lining.
You know, it's so empowering to actually understand what's happening inside your body when you take a seemingly simple pill. So the next time you find yourself standing at the local pharmacy looking for relief, ask yourself, what exactly am I trying to fix today? Will you treat the headquarters, or do you need to send help directly to the local branch? Thanks so much for joining me on this explainer, and I'll catch you on the next one.